Hi. While vaccines have long been a topic of debate, public conversations have only become more intense and divisive in recent years. This has led to oversimplified groupings of people into anti and pro camps when we believe perspectives are a lot more complicated than that. In this project, led by Dr. Cindy Jardine, which is part of a $14.6 million grant aimed at supporting public confidence in vaccines, we're hoping to better understand the various reasons people choose to decline some or all vaccines. And this project is also very intentionally about refusal as opposed to hesitancy, which is a much more studied phenomenon. We also hope to understand more about how people seek information and how they identify trustworthy sources. We want to hear from people about their thoughts on how health authorities could better keep people safe during a pandemic. So we've just started data collection. We just talked to 6 people so far. In most ways, their backgrounds were very diverse, but what they did all have in common is that they are parents, and almost all of them were getting routine vaccinations for themselves and their children right up until the pandemic. So we're already seeing that COVID was a major turning point. And while I don't have time to talk about any emerging themes really, some notable takeaways are just the importance of personal sources over impersonal expertise, and also just the importance of relationships, especially if you have a family member working in healthcare or a respected community member, the potential for these people as influencers, and also representation. So just a few people importantly said, my attitude would probably be wildly different today if I had seen more genuine engagement on the part of health officials with the concerns of people that spoke and looked like me. So basically, if they'd seen themselves more reflected in the public forum. So our next steps are to involve frontline healthcare workers to talk about their strategies to mitigate fear around vaccines at the local level, and then collaborating with Keith Carlson to trace vaccine attitudes as they've evolved historically in local Indigenous communities. Thanks.